Acute heart attack occurs when the flow of blood to the heart muscle is blocked, most often caused by a buildup of fat, cholesterol, other substances which form a plaque or a block within the blood vessel or the heart blood vessel which supplies the heart muscle. The interrupted blood flow can damage or destroy the part of the muscle. The heart attack is caused by formation of a blood clot or a thrombus which completely blocks the blood flow to the heart. It's also called as myocardial infarction and it can be fatal, but treatment has improved dramatically over the last several years. It's crucial to call for emergency medical services if you have a doubt that you are having a heart attack. An acute heart attack occurs when one of your blood vessel to the heart becomes completely blocked. Over time, a coronary artery can narrow from slow or gradual buildup of blockage called atherosclerosis, and a sudden complete occlusion can occur due to triggering and formation of blood clot which completely blocks the blood vessel. It may be because of a plaque rupture, whereas cholesterol can spill into the bloodstream which can trigger a formation of blood clot at the site of the rupture. If large enough, the clot can completely block the flow of blood through the heart blood vessel. Another cause for heart attack is spasm or sudden narrowing of the heart blood vessel, that's shutting down the blood flow to the heart muscle. A heart attack can also occur with spontaneously when the artery dissects or tears due to sudden increase in the stress. The gold standard treatment for acute heart attack is primary angioplasty, which means opening of the blocked vessel immediately by looking at it in X-ray and removing the block by catheter means. The other treatment option for acute heart attack is thrombolysis, where a drug which bursts the clot is given in an emergency. The advantage of thrombolysis is it is available almost universally when you don't have access to the cardiac catheterization laboratory or hospital. The best treatment for acute heart attack is acute angioplasty, where the patient is taken up into the cath lab and the block seen and manually removed in the cath lab by placing a stent, which is the best treatment and is called as primary angioplasty. Primary angioplasty or angioplasty done to remove the block in acute heart attack is an emergency procedure in a patient with ongoing heart attack. Heart attacks occur due to sudden total occlusion of blood vessels supplying the heart, thereby completely cutting off the blood supply to a portion of the heart muscle. These 100% blockages need to be removed within the 12 hours from the onset of heart attack. The goal of this revascularization procedure is to increase the blood flow to the heart muscle by cleaning out the blood clot from the ruptured block that is blocking the blood vessel. Shorter the time, more muscle is saved with minimal damage. Delay causes the muscle of the heart to become completely damaged and to permanently. Doing an angioplasty in a critical patient of heart attack is in itself challenging, and doing so in a critical time window period within the first 3 to 6 hours further adds to this challenge. Recommended door to balloon time, that is a time the patient reaches a hospital till the artery is open, should be less than 90 minutes. The only other option available for treatment of heart attack is thrombolysis. These agents, called thrombus busting medications, when administered in patients, dissolve the clot in 60 to 65% of the cases. In the remaining 35 to 40% of the cases, either due to failed thrombolysis or even if they survive the attack, go home with a very weak heart muscle due to a large portion of heart muscle being permanently damaged. On the other hand, the success rate of primary angioplasty is more than 95% when performed in experienced hands. Conventionally, angioplasty is done with a small balloon at the end of the tube is inflated. When it is deflated and removed, the pressure from the inflated balloon presses the block against the wall of the artery, creating more room for the blood to flow. Primary angioplasty nowadays is being done more without balloon dilatation because of the possibility of blood clot migrating down. Primary angioplasty nowadays is being done more without balloon dilatation because of the possibility of blood clot migrating down the same blood vessel distally during the inflation of the balloon.